Simulation has been used in medicine for thousands of years. Simple or complex, simulators have long been recognized as being an important tool for the education and training of healthcare personnel. Over the years, there have been various designs for various specialties, each with different training goals and levels of complexity. Designed for teaching anatomy, clay livers were discovered dating back to 1900 to 1600 BC in Babylonia. Descriptions of surgical simulators that were made to imitate human bodies and could bleed and leak body fluids have been found dating back 2,500 years. Similarly, an acupuncture simulator that could indicate correct needle placement with a drip of fluid from the needle was reportedly used in China in 1027. In 1911, a U.S. doll maker, Martha Jenkins Chase, was enlisted to make the first training doll for nurses. Aware of the benefits of using simulators and simulation training, in the 1940s, the U.S. Army started using mannequins to train its corpsmen on the practices of medical techniques. The 1960s is when innovations in patient simulators really took off. In Norway, a doll maker, Asmund Lærdal, was commissioned by anesthesiologists to make a doll for medical teaching. The Resusci-An was created for mastering the new practice of mouth-to-mouth resuscitation. The Resusci-An gained popularity and soon became a global success in the healthcare industry. In 1967, the first electronic patient simulator was created in California with the goal of creating a training tool for practicing anesthesia induction, intubation, and other tasks. Nicknamed the Mechanical Man, the Sim-1 was revolutionary for its time. It could mimic breathing, coughing, vomiting, blinking, and pupil dilation. Unfortunately, its extremely high cost, around $270,000, made it cost prohibitive, and it was only used by a few centers for a relatively short period of time. Procedural electronic simulator, the Harvey simulator, was also developed in the late 1960s. The Harvey simulator was created by a physician, could replicate over 25 cardiac conditions, and was used widely in medical education. The Harvey simulator was studied at length to help determine the benefits of patient simulators in medical training. Patient simulator mannequins are more advanced than ever before. Technology has allowed the replication of numerous patient features, care situations, and scenarios for multiple training options. There are generally two types of simulation in use today: procedural and immersive. Procedural simulation focuses more on technical skill acquisition, while immersive simulation aims to create a scenario by which multiple teaching opportunities, not just technical skills, are addressed. While both types of simulations can be practiced with advanced technology simulators, immersive simulation can actually be done without the use of a lot of technology. The focus in immersive simulation is on cause and effect, teamwork, communication, and processes more than technical skills. The commonly used simulator today is the patient simulator mannequin. Patient simulator mannequins have a wide range of features, from simple lung expansion and chest movement to highly sophisticated electronic mechanisms. Electronic simulators can mimic various features of real living patients, such as breathing, heart tones, skin color, EKGs, and pupil reactions. Some have blood and body fluids for procedural simulations. These simulators are controlled using computers and can utilize an interactive system of cameras and microphones to allow the operator to respond to the trainee's actions during the simulation event. Patient simulator mannequins are used by various institutions and healthcare professionals. From high schools, universities, hospitals, and military bases, patient simulators can be used to train students and teachers, patients, family members, phlebotomists, paramedics and EMTs, nursing and medical students, nurses, doctors, techs, respiratory therapists, and other ancillary medical personnel. One of the most commonly used patient simulator mannequins is the Simple Simulator for CPR training. The highly advanced mannequins are more typically found in educational institutions or hospitals for augmenting the training of nurses, doctors, and ancillary healthcare personnel. These mannequins can be used to teach individual and group response to medical emergencies and certification in skills such as CPR, ACLS, PALS, and other advanced resuscitation techniques and skills. The biggest advantage of training in a patient scenario that uses patient simulator mannequins is the reduction of risk to a live patient. Using mannequins to practice techniques allows participants to gain experience in procedural tasks and decision-making without the risk of making a mistake and harming a patient. The simulation environment allows for a reduction in anxiety and a mechanism by which participants can practice skills and scenarios repeatedly until they have achieved a high level of confidence in dealing with numerous aspects of a patient care scenario. Although technical advances have created patient simulator mannequins who have blood flowing in their veins for the purpose of venipuncture practice and air moving in and out of the lungs independently, there is still nothing that can perfectly duplicate the texture and properties of human skin, tissue, and physiological processes. Unfortunately, no manufactured mannequin available now can give the trainees the actual sensation of caring for a live human being. Use of simulation training and risk-free practice can greatly improve the skills and confidence needed to care for patients in stressful circumstances. The future of patient simulator mannequins and simulation for healthcare education is limitless. Future technology advancements like virtual reality, holograms, AI, and other modalities have the potential to greatly improve healthcare training and patient care everywhere.